if you are getting ready for surgery, all right, you have been told you got to have surgery and you're trying to figure out how you're going to determine who's going to be the surgeon, okay? So let me tell you, I got some tips for you. 2 tips. If your surgeon, the one that you're considering, they got to do one of 2 things. If they don't do one of these 2 things, then you need to be like, don't let them cut on you. Do not let them cut on you. Okay, so my personal experience.
911, what's your emergency?
Because when you call your doctor, they just going to tell you to come to the ER anyway. What the ER going to do, child? What we going to do? I'm Dr. Jerisa, ER, your board certified emergency medicine physician, your good doctor, trying to help y'all be good patients and understand what the ER gonna do, what the ER ain't gonna do, and what you need to do when you leave there. All right? As well as helping you understand what you need to do while you in that waiting room, honey. While you're in the waiting room, and then speaking of waiting room, wait on him. Wait on him. All right? He will renew your strength. Listen, so my personal story with a surgeon that messed up my vocal cords. You hear my voice now? You hear my voice? Yes. She got a voice. You can hear me. Those of you who know my story, those of you may not. And praise God, I ain't had no issues, no complication. I ain't had to see no surgeon. I ain't had to see no ENT doctor in going on 2 years, I guess now, when the procedure was done. Praise God. Ain't no pain. Ain't never been no pain. I just couldn't talk. I couldn't talk for, so many months after the thyroidectomy. I had a thyroidectomy. And so with my thyroidectomy, the dang on surgeon, child. Listen, all you got to do is say, I'm sorry. I'm sorry goes a long way. Own it. I'm sorry goes a long way. Denial, that don't sit well with me. So, child, she tried to deny. Meanwhile, I'm sounding like Donald Duck and Elmo. My 5-year-old son thinking Elmo is like live in person, reincarnated in me, like I'm sounding like Disney and Nickelodeon and, just all the characters, Mickey Mouse, everybody. That was what I sounded like. The surgeon said that, the one that messed it up, said, ain't nothing you can do. Time, maybe. Ain't nothing you can do. I was like, what about these injections I heard? She said no. Look like me. She said no. Ain't try to offer no alternatives or anything. But anyway, but God. I said, but anyway, but God. All right. I was able to get that second opinion. All right. Very important. Get that second opinion led me to another ENT who kept me all right and together. Yes. And so what I want to say, because that's really just a summary, a quick summary. When you are trying to decide who is going to put you under the knife, listen, 1 or 2 things they got to do. So now for me, it's after the fact. I was crying. I was devastated. I'm like, my voice. I'm sounding like, are you kidding me? When am I going to get my voice back? Huh? I mean, I was crying, and it wasn't no acting, of course, because this is after the fact. Now, I'm going to tell you, because this is before the fact with you, you're going to have to try to get a, Oscar nomination, Emmy nomination, who else? SAG, Tony nomination. Because when you are interviewing them, if you will, you're going to have to start, you're going to have to bust out a tear. You're going to have to cry. Doctor, what do you mean I got to have surgery? No. You gotta cry. You gotta cry, because that's a test. Now, here's the thing. Because, see, when I was in her office, those were real tears. All right? Those were real tears. And her nurse practitioner, thankfully, she took a seat, grabbed a chair, sat down, because she was taken aback. She was taken aback. So, of course, if you're empathetic, naturally, you should show some kind of emotion, some kind of show of concern. And that's what her nurse practitioner did. Well, she exited. She went on to see some more patients. The doctor comes in. Again, this is after the complication, after she messed up my recurrent laryngeal nerve, and my vocal cord was stuck like this, and it wouldn't move. I'm crying. She had zero reaction. Zero. I'm like, do you see me? Do you see me crying? Like, you just gonna stand there? You just gonna stand there? See, now, if I would have known this beforehand, I wouldn't have. No, I wouldn't have went to her. You know what I'm saying? I wouldn't have went to her because she had no reaction. Your surgeon, when they see you cry, if they're standing up, they better, okay. Let me sit down here, you know, like they about to deliver some bad news, you know, like, you know, they didn't just say you had something deadly. They better change the misdemeanor. Did I say misdemeanor? I didn't mean not misdemeanor like misdemeanor Elliot. They better change their demeanor, okay? And if they're already sitting, then there really also still needs to be some reaction that you can say, this surgeon cares. This surgeon, I will trust them to do what they have to do. And if anything happens, because complications can happen, okay? If anything happens, I will feel comfortable that they can go along that journey with me, you know, to rectify the complication, all right? So that's what I got to say, y'all, because my experience with her, and she was black like me. I'm like, you know, what's going on? This what we doing? This what we doing? You can at least say, I'm sorry, Dr. Jerisa. We gonna work it out. It's gonna be okay. I had to go see another ENT doctor that said the complete opposite of what she said and got me together, right? So I give God all the glory, y'all, because this is pretty much my normal voice, you know. Some people forgot what even happened, but I know what happened, and I know that it was a way for God to really give me a new voice, you know. That's why I'm here right now, talking to you, because it's a testimony. And I'm telling you, go to God. He gonna work it out, and he gonna work it out his way and in his time. Some things also, you know what? While I'm on this, some things are supposed to happen. Okay, as much as you might be like, God dang, you know what I'm saying? Like, why this gotta be my story? Some things are supposed to happen to really mold you and get you on the pathway that you really need to be on. Okay? And so, as much as I despise her, I was like, man, I almost need to thank her. You know what I'm saying? Because her mistake, i.e., what the enemy, what Satan meant for bad, God turned it around. Hey, for good. And you can hear my voice right now. I don't sound like Elmo. I don't sound like Donald Duck. And I'm here to tell you that using those things, you know, it's not just about how smart they are, how smart you think they are. It's not just about their ability. It really also is about their bedside manner. Child, it is so important. It is about their character, their spirit that goes along with their knowledge and their education. That I would implore you to really try to put that together as you're looking for your surgeon, for whatever surgery you are preparing to have. So, did I say who I was? I think I said who I was. So anyway, that's that for, did I say who I was? I think I did. Anyway, Dr. Jerisa, ER, your board certified emergency medicine physician, a good ER doctor trying to help y'all be good patients. All right, trying to help y'all be good patients. So preparing for surgery is no easy thing. It can be full of anxiety. It can be very scary for some people. You know, it's crazy. I went through IVF so much. I used to be scared to go through anesthesia. I was like, oh Lord, when they put me to sleep, oh Jesus, what they doing? I actually used to tell the surgeon, you better wake me up. Now, sir, you know, doctors, whatever, make sure you wake me up now. Don't be playing. Don't be playing. And then I had a miscarriage and I had fibroid surgery. When I had those things, I'd be like, look, y'all better wake me up. Don't be messing around here. Make sure y'all watch them monitors and wake me up. I said it. I used to be so afraid. And yeah, I said afraid. My husband always be like, why you say afraid? It's afraid. I'm like, afraid. We good. It's tomato. Like, come on. To go through anesthesia. And now I just be like, you know, same thing, colonoscopy, endoscopies, whatever. You know what I'm saying? I'm like, okay. Get you some good sleep. Praise God. Pray to God you're going to wake up and everything going to be all right. No complications because you picked the right surgeon. You listen to me. And you use that to select the right surgeon. All right? Bye. It's going to all be well.
911, what's your emergency?